the month of October, and you know what that means. It's Breast Cancer Awareness Month, and we have some interesting information to share with you about breast cancer. So joining me this morning is Dr. Brittany Stam. She's an OBGYN from MomDoc, and you're here to tell us about this latest finding in breast cancer, but also about your practice's living room concept, which I find very interesting.
Right.
Give us some background on MomDoc. I know you guys have been in the Valley for a while here, but tell us what you do and the services that you offer.
Right. So, well, I'm new to MomDoc as a practice, but MomDoc has been around the Valley since 1976. We have locations in all four corners of the Valley. And what drew me to the practice, one of the reasons was this unique approach to patient care and something that we refer to as the living room model. And basically what that is a spin on the traditional sense of the front office desk in a medical building. Instead of walking in and potentially being greeted by a patient, a person behind a glass wall, you're walking into a living room setting and you're greeted by an actual person that sits down with you in our living room in a couch-like setting, greets you face to face and interacts with you, making you feel much more comfortable, and that person's with you from the beginning of your visit to the end.
How nice is that? And it's very intimate. I mean, look at that right there.
Right.
Versus when you walk in and you're behind the glass window and
Exactly.
like waiting for the doctor to come out. Oh my goodness. That's
no, and the
beautiful.
patients seem to benefit from it, in that they're extremely at ease and comfort from the moment that they walk in, which definitely makes our job easier by the time that we're seeing them in the room. They're feeling comfortable and they're leaving knowing that they're the center of that visit. And for us, it's our every endeavor is to make every woman understand that they're able to communicate their healthcare concerns with us and trust us from the beginning.
And I'm sure you're getting great feedback about it too.
No, it's been great.
I mean, it just looks terrific. All right, everyone is wondering this latest finding with breast cancer. Where are we at? Is it still 1 in 8? Have we made some more strides here?
It's still 1 in 8, so that that incidence is very high. So we're looking at all the possible risk factors that are involved, and we know that increasing age is the #1 risk factor right now. There's also, we talk about different lifestyle changes that do increase your risk for breast cancer, but #1, it's age.
The age. Okay, what is the average age of women who are being diagnosed at this point?
Women at this point diagnosed, over the age of 50. We start, screening at the age of 40 because we know that there's something called the sojourn time. This is the time period where breast cancer is too small to become symptomatic, but it's able to be picked up by mammography. But most women over that age of 50 are really at, higher risk.
See, and I was diagnosed at the age of 42, but I was getting baseline mammograms at the age of 31 because my mother was a breast cancer survivor and she was diagnosed at the age of 58. So if there's a viewer out there who's kind of in the same situation, like, well, wait a minute, my mother was diagnosed, or my sister or my aunt, should they be getting mammograms at an earlier age? I mean, and what is the baseline? Is it 40 now? Is it 50? Where are we at with that?
So the American College of OBGYN still recommends that average risk women will begin yearly mammograms starting at the age of 40. When you're talking about, family history, that changes everything. And what we advise women is that if you do have a family history of a first-degree relative, mother, sister, daughter, you come to your doctor, let them know about that risk, and they will decide when to begin screening. And it is recommended earlier, usually about 10 years before the age that your primary relative was diagnosed.
So they start screening at an earlier age, and then comes into play the genetic testing. I mean, I know Angelina Jolie really put breast cancer in the forefront, as well as the BRCA, the BRCA1 carrier,
Right.
and how she was proactive in dealing with her potential breast cancer situation.
Right.
Talk about that.
So the Angelina effect is what it's been called, and basically what we saw is that when Angelina came out to the public and announced that she had underwent a prophylactic double mastectomy after finding out that she had inherited a genetic mutation, the BRCA mutation, which substantially increased her risk of breast cancer, the referrals for genetic testing at that point more than doubled. And what we saw is patients coming in discussing with their providers their family history. it's, genetic testing isn't for everybody. We have to understand that hereditary breast cancer, only about 5 to 10% of breast cancers are due to those inherited genetic mutations. So it's not that we need to go about screening everybody for the genetics, but if you are somebody that has that family history, definitely we advise, come into the office, sit down, discuss it with a healthcare professional that is informed about the genetic risk, and they can guide you as to risk and benefits of the tests and decide if it's right for you.
That's so great to know, instead of just going in and be like, okay, here's the mammogram, and then we're going to do an ultrasound.
Right.
But to bring that to the forefront as well, because, well, in my opinion, it's just the next test that you need to take that's going to determine, if you're cleared or not.
Right.
And lifestyle. Mm-hmm. I mean, we as a society, we love to eat.
Yes.
And we are, as a society, out of shape. However, if you can improve your lifestyle, I mean, don't get me wrong, if you're going to be out there and you're not working out and you're drinking beer and junk food and everything else, then you're going to have, in the long run, a slew of problems.
Right.
But how can we adjust our lifestyle so that we're not at risk for getting breast cancer?
Right. So we know that definitely obesity plays a huge factor in increasing our risk of breast cancer. There was a recent study that was put out in April in British Journal of Medicine that looked at something with skirt sizes, and they had found that women that had increased their skirt sizes by 2 over a period of 10 years had a substantially increased risk of breast cancer by 70%. And we don't use skirt size as something to give us an idea of waist circumference, but for the public, it's easy to understand that obesity is related to breast cancer. All that extra fat cells produces more estrogen, which then can go on to stimulate abnormal cell growth.
And if you can just take care of yourself and watch what you eat and exercise, the risk will go down. For more information, you can always visit MomDoc.com. Thank you so much.
Sure,
we'll
thanks.
be right back with more of the Morning Scramble.